Would you like free audiobooks? Click the link in the description. Question 1. A nurse is reviewing fetal circulation with a group of nursing students. Which structure is responsible for shunting blood from the pulmonary artery to the aorta in the fetal circulatory system? A. Ductus venosus. B. Foramen ovale. C. Ductus arteriosus. D. Umbilical vein. Correct answer. C. Ductus arteriosus. Rationale: the ductus arteriosus is a fetal blood vessel that connects the pulmonary artery to the aorta, allowing most of the blood from the right ventricle to bypass the fetus's fluid-filled non-functioning lungs. The ductus venosus shunts blood from the umbilical vein to the inferior vena cava, while the foramen ovale allows blood to flow from the right atrium to the left atrium, bypassing the lungs. Question 2. Which statement best explains the function of the foramen ovale in fetal life? A. It carries oxygenated blood from the placenta to the fetus. B. It connects the pulmonary artery to the descending aorta. C. It allows blood to flow from the right atrium directly to the left atrium. D. It transports waste products from the fetal to the maternal blood. Correct answer. C. It allows blood to flow from the right atrium directly to the left atrium. Rationale: the foramen ovale is an opening in the septum between the right and left atria of the fetal heart. It serves to allow oxygen-rich blood from the placenta to bypass the non-functional fetal lungs by flowing directly from the right to the left side of the heart, where it is then pumped to the rest of the body. Question 3. During a prenatal visit, a nurse explains the role of the placenta in fetal development. Which of the following is not a function of the placenta? A. Producing hormones to maintain pregnancy. B. Providing oxygen to the fetus. C. Excreting urine for the fetus. D. Transferring nutrients from mother to fetus. Correct answer. C. Excreting urine for the fetus. Rationale: the placenta facilitates the exchange of nutrients and oxygen from the maternal to the fetal blood, and waste products from fetal to maternal blood. It also produces hormones such as human chorionic gonadotropin, HCG, estrogen, and progesterone to maintain pregnancy. The fetus's own kidneys produce and excrete urine into the amniotic fluid, not the placenta. Question 4. A nursing student is asked about the role of HCG in pregnancy. What should the student correctly identify as a primary function of HCG? A. Promotes the maturation of the fetus's lungs. B. Maintains the endometrial lining of the uterus. C. Stimulates the development of the fetal gonads. D. Ensures proper implantation of the embryo in the uterus. Correct answer. B. Maintains the endometrial lining of the uterus. Rationale: human chorionic gonadotropin, HCG, is primarily responsible for maintaining the corpus luteum during pregnancy, which in turn secretes progesterone. Progesterone maintains the endometrial lining of the uterus during pregnancy, preventing menstruation and supporting fetal growth and development. Question 5. What is the significance of the umbilical arteries in fetal circulation? A. They carry oxygenated blood from the fetus to the placenta. B. They return deoxygenated blood and waste from the fetus to the placenta. C. They transport oxygenated blood from the placenta to the fetus. D. They are remnants of fetal development with no blood flow. Correct answer. B. They return deoxygenated blood and waste from the fetus to the placenta. Rationale: the umbilical arteries carry deoxygenated blood and waste products from the fetus back to the placenta. This contrasts with the umbilical vein, which carries oxygenated, nutrient-rich blood from the placenta to the fetus. The role of the umbilical arteries is crucial for the removal of fetal metabolic wastes. Question 6. A nurse is educating a group of nursing students on fetal hemoglobin. What should the nurse explain as a key characteristic of fetal hemoglobin compared to adult hemoglobin? A. Fetal hemoglobin has a lower oxygen affinity than adult hemoglobin. B. Fetal hemoglobin allows for increased transfer of oxygen across the placenta. C. Fetal hemoglobin results in reduced oxygen delivery to fetal tissues. D. Fetal hemoglobin is identical in structure to adult hemoglobin. Correct answer. B. Fetal hemoglobin allows for increased transfer of oxygen across the placenta. Rationale: fetal hemoglobin has a higher affinity for oxygen than adult hemoglobin, which facilitates the transfer of oxygen from the mother's blood, which has adult hemoglobin, to the fetus. This higher affinity ensures that the fetus receives adequate oxygen despite the relatively low oxygen environment of the placental blood supply. Question 7. In fetal development, which of the following best describes the role of the ductus venosus? A. It diverts some blood away from the liver directly to the inferior vena cava. B. It connects the two atria for better mixing of blood. C. It carries oxygenated blood from the umbilical cord to the fetus's heart. D. It is a protective membrane that covers the fetal blood vessels within the umbilical cord. Correct answer. A. It diverts some blood away from the liver directly to the inferior vena cava. Rationale: the ductus venosus is a vascular channel in the fetal circulation that shunts a portion of the oxygenated blood from the umbilical vein directly to the inferior vena cava, thus bypassing the liver. This mechanism allows for a greater volume of highly oxygenated blood to reach the fetal heart and brain. Question 8. A nursing student is learning about the timing of various fetal developments. At what gestational age does the fetal heart typically begin to beat? A. 2 weeks. B. 5 weeks. C. 8 weeks. D. 12 weeks. Correct answer. B. 5 weeks. Rationale: the fetal heart begins to beat at about 5 weeks of gestation. This early heartbeat can sometimes be detected by ultrasound as early as the end of the 5th week, which is a critical development milestone in early pregnancy. Question 9. A nurse explains the changes in the fetal circulation that occur at birth. Which event directly causes the closure of the foramen ovale? A. Clamping of the umbilical cord. B. Increase in oxygen saturation within the baby's blood. C. Decrease in pressure in the right atrium of the heart. D. Increase in pressure in the left atrium compared to the right. Correct answer. D. Increase in pressure in the left atrium compared to the right. Rationale: the closure of the foramen ovale is primarily driven by the reversal of atrial pressure gradients at birth. After birth, as the baby begins to breathe air, the pressure in the left atrium increases compared to the right atrium due to the influx of blood returning from the lungs. This pressure difference pushes the septum primum against the septum secundum, closing the foramen ovale and functionally separating the atria. Question 10. Which hormone is primarily responsible for the development and maintenance of the corpus luteum during the early stages of pregnancy? A. Estrogen. B. Progesterone. C. Human chorionic gonadotropin, HCG. D. Human placental lactogen, HPL. Correct answer. C. Human chorionic gonadotropin, HCG. Rationale: human chorionic gonadotropin, HCG, is crucial for the development and maintenance of the corpus luteum during early pregnancy. The corpus luteum produces progesterone until the placenta is sufficiently developed to take over this function, ensuring the endometrium remains conducive for the implanting embryo. Question 11. A nursing instructor is discussing the physiological adaptations of the neonate immediately after birth. Which physiological change is responsible for the closure of the ductus arteriosus? A. Increase in prostaglandin levels. B. Decrease in blood glucose levels. C. Increase in pulmonary blood flow. D. Decrease in fetal hemoglobin levels. Correct answer. C. Increase in pulmonary blood flow. Rationale: the ductus arteriosus typically closes due to an increase in pulmonary blood flow following the initiation of breathing at birth. This increase in blood flow raises the oxygen tension in the blood, which triggers the constriction and eventual closure of the ductus arteriosus. Question 12. During a prenatal class, a nurse explains the critical periods of teratogenic risk in fetal development. Which time frame is most susceptible to teratogens affecting the central nervous system? A. 0 to 2 weeks gestation. B. 3 to 8 weeks gestation. C. 9 to 16 weeks gestation. D. 17 to 24 weeks gestation. Correct answer. B. 3 to 8 weeks gestation. Rationale: the period from 3 to 8 weeks gestation is crucial for the development of the central nervous system and is when the fetus is most vulnerable to teratogens. During this period, the major organs and structures are forming, making the fetus particularly sensitive to any external influences that could cause malformations or developmental disruptions. Question 13. Which of the following describes the role of the umbilical vein in fetal circulation? A. Carries deoxygenated blood from the fetus to the placenta. B. Carries oxygenated blood from the placenta to the fetus. C. Transports nutrients from the fetus to the placenta. D. Removes carbon dioxide directly from the fetal heart. Correct answer. B. Carries oxygenated blood from the placenta to the fetus. Rationale: the umbilical vein carries oxygenated, nutrient-rich blood from the placenta directly to the fetus. This is essential for providing the oxygen and nutrients needed for fetal development. Question 14. A nurse is explaining the development of the gastrointestinal system in a fetus. At what gestational age does the fetus begin to swallow amniotic fluid, contributing to the amniotic fluid volume and gastrointestinal development? A. 5 weeks. B. 10 weeks. C. 16 weeks. D. 20 weeks. Correct answer. B. 10 weeks. Rationale: fetal swallowing begins around 10 weeks of gestation. This action plays a critical role in regulating the volume of amniotic fluid and also stimulates the development of the gastrointestinal tract. Question 15. Which fetal development marker indicates that surfactant production is sufficient to support adequate gas exchange if born prematurely? A. Development of type 2 alveolar cells at 20 weeks. B. Presence of breathing movements at 24 weeks. C. Increase in chest wall movements at 28 weeks. D. Maturation of alveoli by 35 weeks. Correct answer. D. Maturation of alveoli by 35 weeks. Rationale: while surfactant production begins around 24 to 28 weeks, it is the maturation of the alveoli by around 35 weeks that indicates there is likely sufficient surfactant to support adequate gas exchange, significantly increasing the chances of survival without severe respiratory distress if born prematurely. Question 16. During a seminar on fetal development, a nurse details the development of the fetal kidney. What is the gestational age at which the kidneys begin to produce urine? A. 8 weeks. B. 12 weeks. C. 15 weeks. D. 20 weeks. Correct answer. B. 12 weeks. Rationale: fetal urine production begins around 12 weeks of gestation. The kidneys start to function and produce urine, which is then released into the amniotic fluid, playing a role in its composition and volume. Question 17. A nursing student is learning about fetal cardiovascular development. Which statement correctly describes the timing of the development of the four-chambered heart in the fetus? A. It is completely developed by the end of 4 weeks of gestation. B. It is completely developed by the end of 8 weeks of gestation. C. It begins to form at 8 weeks and completes by 12 weeks of gestation. D. It begins to form at 5 weeks and completes by the end of 10 weeks of gestation. Correct answer. B. It is completely developed by the end of 8 weeks of gestation. Rationale: the 4-chambered heart structure is fully developed by the end of 8 weeks of gestation. Early in development, the heart begins as a simple tube and progresses to a fully developed 4-chambered heart by this critical developmental milestone. Question 18. Which hormone is responsible for the softening of the maternal symphysis pubis and dilation of the cervix during late pregnancy? A. Estrogen. B. Progesterone. C. Relaxin. D. Oxytocin. Correct answer. C. Relaxin. Rationale: relaxin is the hormone primarily responsible for the softening of the maternal symphysis pubis and the dilation of the cervix during late pregnancy. It helps to prepare the maternal body for childbirth by loosening the ligaments and softening the cervix. Question 19. A nurse is explaining how fetal movements are assessed during a prenatal visit. Which type of fetal movement is typically felt by the mother starting around 20 weeks of gestation? A. Quickening. B. Hiccups. C. Rotary movements. D. Stretching. Correct answer. A. Quickening. Rationale: quickening, or the initial movements of the fetus felt by the mother, typically begins around 20 weeks of gestation for first-time mothers. These movements may be described as flutters and are an important indicator of fetal activity and health. Question 20. During a prenatal visit, a nurse discusses the risks associated with fetal alcohol syndrome. What is the primary mechanism by which alcohol affects fetal development? A. It causes constriction of the fetal blood vessels. B. It disrupts the placental transfer of nutrients and oxygen. C. It leads to abnormal gene expression and cell development. D. It induces premature labor. Correct answer. C. It leads to abnormal gene expression and cell development. Rationale: alcohol exposure during pregnancy primarily affects the fetus by disrupting normal cell development and function, and by altering gene expression. These effects can lead to a range of developmental disorders known collectively as fetal alcohol syndrome, characterized by growth deficiencies, facial abnormalities, and central nervous system dysfunction. Question 21. A nurse is educating students about the critical developments in fetal cardiovascular system. At what gestational age does the heart start to beat, and at what age is the cardiovascular system fully operational? A. Heart starts at 5 weeks, fully operational at 10 weeks. B. Heart starts at 3 weeks, fully operational at 8 weeks. C. Heart starts at 5 weeks, fully operational at 12 weeks. D. Heart starts at 6 weeks, fully operational at 10 weeks. Correct answer. C. Heart starts at 5 weeks, fully operational at 12 weeks. Rationale: the fetal heart begins beating at approximately 5 weeks of gestation. However, the complete setup of the cardiovascular system, including the development of major vessels and the final establishment of circulatory routes, typically becomes fully operational around 12 weeks of gestation. This marks a crucial period for fetal development as the cardiovascular system must support increasingly complex bodily functions. Question 22. A nursing student is asked about the role of human placental lactogen, HPL, in pregnancy. Which of the following is a primary function of HPL? A. It stimulates the maternal metabolism to provide nutrients to the fetus. B. It reduces the maternal blood sugar levels to prevent gestational diabetes. C. It increases the fetal production of insulin. D. It decreases the maternal absorption of amino acids. Correct answer. A. It stimulates the maternal metabolism to provide nutrients to the fetus. Rationale: human placental lactogen, HPL, plays a crucial role in pregnancy by modulating the maternal metabolism to benefit the developing fetus. It helps in the regulation of glucose availability by making the mother more insulin resistant, thereby maintaining higher levels of blood glucose for use by the fetus. It also stimulates lipolysis, ensuring a supply of fatty acids for maternal energy, and helps in the regulation of amino acid transport to the fetus. Question 23. A prenatal nurse is explaining the development of the fetal nervous system. Which of the following events occurs first in the sequence of fetal brain development? A. Formation of the neural tube. B. Differentiation of the forebrain, midbrain, and hindbrain. C. Establishment of neuronal connections. D. Myelination of the spinal cord. Correct answer. A. Formation of the neural tube. Rationale: the formation of the neural tube is the initial and critical event in the development of the central nervous system, occurring within the first few weeks after conception. This structure eventually gives rise to the brain and spinal cord. Subsequent developments, such as the differentiation of brain regions and the establishment of neuronal connections, follow the closure and development of the neural tube. Question 24. During an assessment of fetal health, a nurse discusses the importance of fetal kick counts. What is the minimum number of movements generally expected to be felt by a pregnant woman within a 2-hour period to consider the fetal activity normal? A. 5 movements. B. 10 movements. C. 15 movements. D. 20 movements. Correct answer. B. 10 movements. Rationale: fetal kick counts are a common and simple method for monitoring the health of the fetus. A count of at least 10 movements, such as kicks, flutters, or rolls, within a 2-hour period is generally considered normal and indicative of a healthy and active fetus. Fewer movements may prompt further evaluation to assess fetal health. Question 25. A nurse is explaining the timeline of fetal sensory development to expectant parents. At what gestational age does a fetus typically begin to respond to auditory stimuli? A. 16 weeks. B. 20 weeks. C. 24 weeks. D. 28 weeks. Correct answer. C. 24 weeks. Rationale: around 24 weeks of gestation, the fetal auditory system has developed to the point where the fetus can start responding to sounds. This development is significant for early interactions between the parents and the fetus, as the sounds of voices and even music can elicit responses such as movement or changes in heart rate. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.